Kian tweets out, the Ontario government released its most recent data on COVID hospitalizations, showing that 46% of all COVID positive patients counted as a COVID hospitalization aren't even in the hospital for COVID. Yikes, right? Whoops, sorry about that, everybody. All the data is misleading and wrong. Here's Christine Elliott. She says, we are updating Ontario's public reporting to distinguish patients hospitalized due to COVID-19 from those who are admitted for other reasons with COVID-19. So that's interesting and further muddying the waters. Here is Dr. Henry. Is this Dr. Henry? Oh, no, Dina Hinshaw. This is Hinshaw, and she's talking about exactly the same thing that happened in Ontario. Collective or coordinated, and they're coming clean at the same time. Why? I don't know. Here's Hinshaw.
As we have been doing continual quality assurance work with our data, it was identified over time some units in some hospitals have shifted back and forth between being available for use as an ICU unit or a non-ICU unit. In some of our historical data, patients admitted for COVID treatment were categorized as being in ICU when the unit they were on, in fact, had been changed back to a non-ICU unit at that time. The adjustments you will see in historical data today now reflect correctly the type of care those patients were provided. This means you will see a decrease in ICU numbers at some points in time, with a corresponding increase in non-ICU numbers. As we have been doing continual quality assurance work with our data.
So all of the data that we've been basing all of the lockdowns on has been faulty, bunk, nonsense, and hasn't been based in reality, just been based in what's been shared, right? And so should we be trusting these people? I said yesterday, like, how many screw ups, how many times do the citizens of an entire province lose their freedom? How many businesses need to go under before the people in charge driving these policies, the healthcare, medical officers of health, the public health people, and all of that, how long before they start feeling the impact of their failed policy, right? Why did they get carte blanche to run the province as they see fit? They can shut it down at any time to save lives. Which lives are they saving? How many lives have they saved? I know they have numbers for that, but it's all bunk, right? Like, we can't trust their numbers because they don't tell the truth. Here is Omicron has put healthcare sector under incredible strain. Yesterday, the Ontario government announced they will use internationally trained nurses to help ease staffing shortages. We hear more at 7:20. So this is the news article. I was right about this, by the way. I told you what they were going to do. And I said, I thought that it had failed. I thought they tried and it had failed. But no, it just hasn't got bad enough yet. So Ontario will deploy internationally educated nurses to hospitals and long-term care homes, facing staffing shortages due to COVID-19. Health Minister Christine Elliott made the announcement on Tuesday while speaking about healthcare and capacity. That's yesterday, just in case you're not sure. So wild, right? That's pretty incredible that, we're just going to import nurses. Forget rehiring those fired unvaccinated nurses. No. We're just going to increase immigration and bring other nurses from around the world and hire them here. Yay.